Hello, welcome to any community. In this particular video, we are going to discuss the Ghranendriya Pariksha, which is considered to be one of the Pratyaksha Pariksha. When you think about the Ghranendriyataha Pariksha, so here Ghranendriya of the clinician is being used, or the person who is going to examine the patient, so that is going to be used. As far as the textual description is concerned, गन्धांस्तु खलु सर्वशरीरगतान् आतुरस्य प्रकृतिवैकारिकान् घ्राणेन परीक्षेत. If you split this particular word, gandhan astu khalu sarvashariragataan aturasya prakriti vaikarikan ghranena pariksheta. If you understand this particular word, आतुरस्य प्रकृति वैकारिकान् गन्धान् घ्राणेन परीक्षेत खलु आतुरस्य प्रकृति वैकारिकान् सर्वशरीरगतान् गन्धान् घ्राणेन परीक्षेत. और अदरवाइज अस्तु खलु आतुरस्य सर्वशरीरगतान् प्रकृति वैकारिकान् गंधान घ्राणेन परीक्षेत. So you can read in this particular way. Further, Sushruta says, घ्राणेन्द्रिय विज्ञेया अरिष्टलिंगादिषु व्रणानाम् अव्रणानां च गन्धविशेषाः. घ्राणेन्द्रिय विज्ञेया अरिष्टलिंग आदिषु व्रणानाम् अव्रणानां च गन्धविशेषाः. दलहन कमेंट्री, अरिष्टलिंगादिषु ए व्रणानाम् अव्रणानां च गन्धविशेषास्ते घ्राणेन्द्रिय विज्ञेया इति सम्बन्धः. अरिष्टलिंग आदिषु ए व्रणानाम् अव्रणानां च गन्धविशेषाः ते घ्राण इंद्रिय विज्ञेया इति सम्बन्धः. If you look into that particular aspect, so that maybe gandha may be produced from any part of the body, maybe from the nose, or maybe from the mouth, or maybe from the anus, that is the flatus that is going to get passed, or maybe from the sweat. So that is whether it is normal or abnormal smell, that has to be perceived by the smell as such. So that means here we are going to, whenever if you think about the interaction with the patient, so here we are going to listen to the patient as such. So that means listening from all the sense organs by the clinician. So that is how we are going to do the the listen to the patient or do the pratyaksha pariksha as such. Further, it is being mentioned that Ghranendriya Vijnaya Arishtalingadishu. So that means whenever if the person is suffering from any kind of the Arishta Lakshana, so that means the signs which are indicative of the death, or otherwise Lingadishu, if it is present any kind of the Lakshana or Rupa is being observed, whether the person may be suffering from any kind of the ulcer, or whether the person is not having any kind of the ulcer, simply there may be a possibility of that skin lesions. Then we are going to examine the smells from these by the help of that Ghranendriya as such. The same is being mentioned by the Dalhana commentary. Arishtalingadishu evrananam, so that has to be perceived by the Ghranendriya of the clinician. Let us have the examples. If the person is consuming more amount of these radish, or the potatoes, for example, the potatoes wherein samosa is being prepared, or otherwise the radish, what we can say, mulika paratha, that is being prepared. When these are consumed in excess, the person may pass the flatus, which is having the foul smell. So that means this is actually responsible for the increase of that ammonia production. In that way we are going to, so this particular smell has to be perceived by the Ghranendriya of the clinician. Let us have one more example. If the person is having excessive sweating, so the extreme left image, wherein the person is having the sweat in excess, so that has to be excessive sweating, which produces typical smell, that has to be perceived by the Ghranendriya of the clinician. In the right example, wherein the person is having the poor dental hygiene or oral hygiene. For example, after consumption, if he is not gargling the mouth properly, then you are going to have what you say that the abnormal smell coming through one's mouth, what we can say medically as halitosis. So that this has to be perceived by the Ghranendriya of the clinician. So the take-home messages from today's discussion are: nose of the clinician has to be used to smell the abnormal smells produced inside the patient's parts, such as lung, wherein the person may have lung abscess, wherein the person may have the bad breath that has to be smelt, or otherwise the mouth, so that is what we can say poor oral hygiene, or large intestine where excessive formation of ammonia is being present, skin wherein excessive sweating is being present. So the next aspect, that is excessive consumption of radish or mulaka or potato or aluka, so that may lead to excessive flatus passage, so which may indicate a digestive impairment. And when the person is having the poor dental hygiene or oral hygiene, there may be a possibility of the person may have some kind of the disturbances related to the oral cavity, or otherwise in case of lung abscess, wherein the person will be having the bad breath as such, so that is indicative of the lung disease as such, or otherwise excessive sweating, wherein we are going to see improper dermatological or skin hygiene as such. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.